Hello, my name is Sarah Schechtman, and I was assigned the role of Secretary of Health and Human Services, abbreviated HHS. So, the Secretary of Health and Human Services is appointed by the President of the United States with the advice and consent from the Senate. As you see, the organizational chart shown here depicts the branches of HHS. One of these branches includes the 11 operating divisions that are utilized to administer the HHS's programs. Some well-known examples are the Food and Drug Administration, the National Institute of Health, and the Center for Disease Control and Prevention. So the mission statement of the U.S. Department of Health and Human Services is to enhance the health and well-being of all Americans by providing for effective health and human services and by fostering sound, sustained advances in the sciences underlying medicine, public health, and social services. So with that being said, there are many roles of the HHS that are ultimately responsible for health and welfare. So these roles include overseeing those 11 operating divisions that we just discussed, which include 8 agencies in the U.S. Public Health Services and 3 agencies in the Human Services Department. These divisions administer a wide variety of health and human services and conduct life-saving research for the nation, protecting and serving all Americans. Another role of HHS includes cross-agency collaboration, such as working closely with state and local U.S. territory governments. Another role would be HHS is the largest grant-making agency in the U.S., which the funds are provided directly to the state, territories, tribes, and education, the community organizations. And other significant roles include fostering advances in medicine and preparing for and responding to public health emergencies and advising the President of the United States on matters of health, welfare, and income security programs. Okay, so at the end of December 2019 and towards the beginning of January 2020, when Chinese health authorities confirmed the novel coronavirus infections with the person-to-person transmissions said to be associated with the seafood market in Wuhan, China. At this time, as a secretary of HHS, I would be declaring a nationwide public health emergency. Under Section 319 of the Public Health Service Act, the Secretary of HHS may determine that a disease or disorder presents a public health emergency, or that a public health emergency, including significant outbreaks of infectious diseases or bioterrorist attacks, otherwise exists. So although at this time the extent to which this virus poses a serious threat to the United States appears low, the emergency declaration would give state and local departments more flexibility to assist and respond in the future. So in addition, I would develop an emergency repatriation response plan for US citizens that are currently in China at this time. The U.S. repatriation program was established in 1935 under the Social Security Act, and it's led by the Office of Human Services Emergency Preparedness and Response program. And this plan will allow for commercial and chartered flights for US citizens and their dependents in China, where the virus is beginning to spread. And lastly, during early 2020, when the virus has begun to spread throughout China, I will be assigning coordinated agency roles to ensure every agency understands the role and so that operations run smoothly and unified. So now down the line in late 2020, when case numbers and death tolls rise across 210 countries. As Secretary of HHS, I will be striving to continue to provide the necessary resources in order to begin rapid distribution of testing resources, such as the PCR antigen testing, as well as vaccine development along with rapid distribution. As one of our main roles at the HHS is to foster advances in medicine and research, and COVID-19 is a prime example of how we will be collaborating with pharmaceutical companies to continue scientific investigations and advance research into vaccines, tests, treatments. So overall, as the Secretary of HHS, our primary goal is to protect the health of all Americans and provide essential human services and leadership. And during the COVID-19 pandemic, the main goal is to protect the health and safety of people and promote effectiveness of HHS's COVID-19 response and recovery programs with hopes of limiting spread and beginning the COVID-19 pandemic, bringing the COVID-19 pandemic to an end. Thank you.